Welcome to Mind Body Temple podcast, your healing space with Dr. Rod. The purpose of this podcast is to bring back hope to patients who are suffering from chronic conditions like chronic pain, anxiety, and depression. In these groups of sessions, I bring some of my dear patients here to share their experience of pain and how they overcome the suffering so they can tell the story to other patients and hopefully bring hope to them. Lindsay is here today, and I'm going to ask right away. Thank you so much for coming and tell us about your history of pain and your experiences.
Thank you very much for having me, and I appreciate the opportunity. So, I've had a long relationship with pain now for quite some time. Um, about 11 years ago, I was inflicted by a tropical disease which left me with a post viral arthritis and connective tissue disease throughout my body. And it's been a very long, tedious journey to help sort of understand what has happened and to learn to accept and to help understand how I can continue to find joy and happiness in life in spite of some of the hurdles, I'll say, that have come my way through acquiring this unique and rare disease.
That's amazing. It must have been very difficult to even find proper help for a condition like that. It's not the most common condition that we deal with, and finding the diagnosis, reaching the appropriate diagnosis, and finding physicians or other healthcare professionals that would help you through the journey must have been very difficult.
It was a very, maybe almost the harder part of this journey was simply maybe the advocating for myself and exactly to your point, finding someone who would be able to help me identify something that's not as common.
Mhm.
So it was many specialists and perseverance to help me reach that understanding of what was actually happening so that I could then work on acceptance.
So, a widespread body pain that affects your ability to function must have affected your ability to work, ability to function as a family person, ability to, your role in the society and the personal experience of life. Tell us a little bit more about the impact of the pain on all of these aspects.
Yeah. So for me, I was a ballerina prior to becoming ill and actually competitive dancer upwards of 7 days a week. So for me, not only the sort of day to day changes, but also the passion and hobby that I had put all of my life focus into was something that I wouldn't be able to perform in the same way anymore or participate in the same way. So being a parent of young children, being a wife, being a daughter, all facets of my life have been somewhat impacted or touched upon because of the chronic pain. I mean, I joke, but sometimes the little things like just we take advantage of or take for granted taking off a gas cap when you're filling up at a pump are things that aren't always easy for me to do that would have been before. So there's been a lot of navigating and creating new pathways to accommodate the changes that it's had on just my day to day ability to mobilize myself and move quickly and lift things and that kind of stuff.
Yeah, every little thing can become
Every
a
little
major
thing.
chore and a hurdle to
Yes. Yeah.
pass through. And the relationship with your family members, how has that impacted?
I feel very blessed in my personal situation. I've got an incredible network of friends and family who care and also advocate for me and support me.
That's fantastic. And I, I haven't been working with you for a long time, despite my other patients that I've been working with for many years. But through these, few sessions that we work together, I realized that you are a very high achiever person. You're very perfectionist in what you do, and you always put up a brave face and go and get the job done.
Thank you.
You're that type of personality, but that must be taxing on you from the energy side, from the also affecting the pain because of needing to get different tasks concluded. Tell me a
Yes.
little bit more about that aspect of
I
the
like the way you
pain
say
and your
taxing.
work.
It's like you pay a pain tax.
Yeah.
So I do think of it that way. um, you know, walking on a flat ground for the average person might not feel as um, effortful as it would be for perhaps somebody who deals with a different type of set of challenges. Um, I still feel that what motivates me is being in the presence of all the people who are unaffected. And I've attempted a few different ways of trying to find my place and to find my acceptance with what I have. And I actually found that trying to dive into communities of other people with this rare illness, where I felt I would find a place and a home to feel accepted and understood by others, it it actually felt more of a place where people were sad and people were feeling defeated or feeling that this was a like life sentence of some sort. And I actually prefer the company of people who feel really good because I actually find that their positive energy and their inhibitions and their non pain tax lifts me up and makes me feel better to want to feel that way as well.
That's amazing. Your condition um, is not very common, but chronic pain is very common, and chronic pain was the outcome of your condition. Can you explain a little bit more for the listeners? I believe that there are thousands and thousands of them that would find common elements in your history and their history, and how the symptoms, what are the diversity of the symptoms from the pain, from the sleep, energy, and mood, all of those aspects. If you can explain a little bit more.
Yeah, it's been an interesting journey. I think if I can kind of go back to when all of this first started, I think pain management in my mind was a lot easier because at the time I had maybe one or two places of some functional pain that I had to sort of think about and then also work on not thinking about. And that was a lot more manageable once upon a time. But as my disease actually progressed, and unfortunately without a cure at the moment, it does seem that it's a bit more of a degenerative situation to be in. I had to understand kind of my emotions associated with the pain I was going through. Some days, a little bit harder to walk, other days, a little bit harder to lift, sometimes just more swollen than others. So, also taking note of a personal sense check of what is it today that I'm afflicted with, because it might not actually be the same as yesterday. And I think for me, I had to learn to have a new relationship with pain than I had previously, where an injury was something very temporary to me. And if
Right.
I broke an ankle, you could put it in a cast, and 6 weeks later, I'd be on the mend. Whereas now I've got to learn to form a healthier relationship with the pain that I have and also appreciate that some of it is emotionally driven because I am unhappy about being in discomfort, as most people should probably expect to feel. So
You
it's
have,
been weird.
yeah, you have been experienced a correlation between the discomfort and also having higher level of stress or lower amount of sleep. When things like that happens,
Very
you
much
feel
so.
more pain.
Absolutely, and nothing more so than the sleep piece itself. Because with chronic pain, just because it's nighttime doesn't mean your pain goes away. Just like you work and then you clock out, the pain's not clocking out just because your body's resting. So I definitely feel that I notice in myself a change in my appreciation for sensitivity to pain, emotional moods, all the things, especially when I've had maybe poorer sleep than other nights too. So, very influenced by some of
Yeah.
those external things.
And then how I know you're a high achiever, because I know how severe your pain has been, and you always put together the best face that you can. And I always smile when you talk about the pain, although you have been significantly suffering, because I'm familiar with your history and I know how much suffering you went through. But nevertheless, you become brave and strong, and you fight the good fight, and you have been improving. But through your journey, I rather use it instead of saying fight. Through your journey to find the healing, what kind of treatments have you had, and you know how the outcome have been for you?
Well, I've tried quite a few things. I've tried seeing quite a few doctors. I've tried doing my own sort of independent research as well. I've done everything from quite a few different medications, which I will not knock medication ever. I mean, of course, there are certain things that can help your journey,
Right.
but I feel like that's just one piece of the puzzle. And what I was finding through, well, try this medication and then try this alternative therapy and then try this and layer, layer, layer. I still found that anything that I was acquiring in those moments were so temporary. And I've had this drive in me since the beginning to absolutely give all of these different options a whirl, still seeking something a little bit more permanent for me in terms of a tool that I could use no matter where I am in the world, or if I'm in an airplane, or if I am in COVID and maybe these options are not available because this is not an essential service. I'm trying to think about how to create my own survival guide for myself. And a lot of the times I feel that um, it's actually been more of the uh, physical and mental tools versus the pharmaceutical tools
Right.
that I've found have been very helpful for me to remain focused on my goal, which is to live the best life I can in spite of anything that gets in the way.
Fantastic. I guess that was your expectation when you came to me first session, that maybe yet another pain doctor, maybe I'll start with some injections or writing you another medication. But then I started to talk about the whole notion of chronic pain, how the acute pain turns into chronic, and how your state of emotional condition now, or even the battery of all of the traumas and emotional memories that you had in the past, can impact the presentation of the pain.
Yes.
And we went through a lot of emotional discussion related to this. And you have been very attentive to all of these concepts, and you're being open to the concept, because there is a part of our work that we have to get the patient to buy in to the idea of the correlation between the emotional state and the level of the volume of the perceived pain. But you have been very open to the concept of the whole mind body concept. I always give the example that if you tell me something that embarrasses me, I'll have red cheeks. So, or if I get frightened, I'll have a very white face. So that's the correlation between my emotional state and my physiological state. And emotional presentation, it is a presentation of my physiological function, anyways. But you have been open to that concept. So tell us a little bit more about your understanding that you found through our discussions related to the correlation between the state of the mind and the body presentation of the pain.
I feel like through working with you, I've come to understand that just the same way there's a bit of the Pavlov's theorem, and we can, as humans, become conditioned to feel certain ways. It's a fight, flight, freeze response mechanism.
Mhm.
And having dealt with some pretty, at times, horrific pain, if I were to put it on a scale, and I've had two kids, so I know what my scale is.
Right.
I I very much feel um, like being more in tune with, you're already worked up about the sensation before it's even fully landed because there's almost a previous trauma attached with the worst of the worst pain. And I don't blame my own self for wanting to protect me from being exposed to that again. But teaching me about that relationship was very important to my mind so
Right.
that now I can think about that and I can feel and sense what comes with the idea that, oh, what bad weather tomorrow, I can expect to not feel well.
Okay.
And now I talk to myself about this um,
Your
all
words are
day.
very strong. The way you talk to yourself is very,
It
very
matters so
important.
much.
Yeah, it goes a long way. And we talked about the stages that we went through. First, clarity about the purpose of uh, your life, and then as a result, the purpose of your treatment and why you're here, and then how important it is to get to the point that became clear to you as the purpose of your life. You went through that practice a little bit. Can you tell me a bit about that part?
It's work, right? It's homework.
Right.
And I think anything worth it in life is not easy to get. That's sort of how I've always perceived things. And I think a lot of folks like me that don't feel well a lot of time would like to hope that there is a instant solution. but I think that it's the short term pain for long term gain that you get when you confront how you're feeling. And you have to actually spend a moment going, wow, I've allowed myself to manifest some of this before it's even landed in my sort of sensory.
Right.
And so now I talk to myself about this, and I start my day with a bit of a level set, and I finish my day with that wasn't so bad. And it's now become a part of my routine. And it's just like brushing your teeth. It's just something you add to your toolkit that supports good hygiene, good mental hygiene.
Yeah, we talked about that concept of message of safety, that
Yes,
you're gonna feel the pain, but you'll tell, okay, I'm aware of the presence of the pain. You have that moment of what we call applied awareness, that you basically bring the mindfulness or applied mindfulness to the presence of your pain, but yet you tell yourself that I am safe despite the existence of this. So you downgrade the pain from a danger signal, as we have learned through our experience of life. Our brain has learned it to be a danger signal, but we downgrade it to a sensory signal, the way a light or a sound is. And then through that degradation of the level of pain that is perceived by our brain, we bring it down to a level that you're not going to suffer from it anymore. You feel it, you recognize its existence, but you tell yourself that you're safe to continue what you're doing. This method, you have mastered it in not a long time, and I'm very impressed by it, because you sent me a message. You told me that you can now control the condition better, and I said that, oh my God, you have to come and explain this to other patients.
absolutely. I think what I was misunderstanding before working with you was that there would be a way to never feel pain again, or like I felt guilty about being in pain. And I think that through the work with you, that safety and that moment to also just appreciate it's okay. You're allowed to have days that don't feel the best.
Right.
Um, I feel just so much better equipped to want to help other people understand that it's just a moment in time, and things don't stay at a 10 out of 10 24 hours a day, 7 days a week. And even if we appreciate that there's a lot of those bad 10 out of 10 moments, enjoying all the times that we're not sitting in them has been a gift back to me, that now I feel like I am enjoying my days again, and I feel excited about my kids, my future, my family, my friends. It's been great.
I could have said it better than that. That's amazing, because I'm very proud of you, how you grasp this concept and you're putting it into work, because you touched on different very important points. Of course, the message of safety is very important. Again, getting back to the neurophysiology of chronic pain, where our central central parts of our brain gets used to receiving all of these signals, and then linked to our past history of emotional traumas, or the whole traumatic history of going through the disease that you went through, that augments the level of the pain, as if the radio is all the way up. And then by repeating the message of safety, you bring down the level of the pain, bringing it back to a sensor signal from a danger signal. But on top of that, you mentioned something else that's very important, and that's the concept of impermanence in life. Everything is impermanent, nothing is permanent. The only permanent rule in universe is impermanence itself. So reminding yourself when things are bad, that nothing stays bad forever, and things will change, is a great point to use to reduce the severity of the pain, because you can endure the pain at its peak because you have the belief that it's not going to be permanent.
Yes.
And that element of hope helps you to pass through that peak of the pain and get to the valley of more calmness. And during the calmness, you can enjoy. You can, but it's again allowing yourself to enjoy. That's another thing, because we become the worst barrier for ourselves to feel worthy of experiencing the zest of life again, and the beauty of the life, and then enjoying the life. But once you allow yourself, once you believe that that's the element of making peace with yourself, that we talked about that as well. So long you're in an internal fight, you don't allow yourself to enjoy the life, even when the pain is not there or it's not as severe. So in this discussion, you basically explained all of these points that are very useful. So if you were going to um, give hope, but not in a way that is just, oh, you're going to be okay, or it's false hope, real hope for how to understand the pain and how to live with the pain, but not suffer from it. And, and through that, living with the pain and not suffer from it, you will reduce the severity of the pain because your brain is not going to understand it as a danger signal anymore. How would you explain it to other people if you were going to explain it to somebody that is very precious to you, somebody that's very important to you?
Yeah, I mean, I think that um, I think of pain like a flame, and there are the fireplace type, and there's the birthday candle type, and there is a change that ebbs and flows, like we said. And what I will say is, because I did not have the tools I have now or the understanding I have now, if I go back 13 years to when I first became sick, and it was, let's say, isolated to less joints or places in the body, I felt much worse about my pain then than I do now that it is very much more widespread, which sounds bizarre, but I am so much more at peace with myself and how I can persevere and how I can overcome and how I can still be so grateful for every day that I think poorly for old Lindsay and how upset and fragile I felt because it was new at the time and I didn't understand. But I'm in more pain, I would think, now than I was then, but I am at more peace now than I was then. So everybody's journey will be ever so slightly different and unique
Right.
to them. But I would just say that there are lots of people that no matter whether it took them 2 months, 2 years, 20 years, there's lots of people that are on the other side of this now, like me, who feel a lot better than I would have had I not tried to teach myself um, the patience, the acceptance, and the perseverance.
Yeah. Like we talked about different sensory signals, like you see the light but you're not looking at the light, or you hear the noise but you're not listening to it. So it's the same concept with the pain that you just described right now. Although there's more pain, but there's less suffering because it's not the center of your life. You're more of a your approach was before um, more of a pain-based life, but now it's more of an activity-based life. And through this journey of focusing on pain and now focusing on your activity, then the level of suffering is less. Can you give me a couple of examples of the tools that you use now when the pain comes to you and when the pain is severe?
Well, definitely just sort of a bit of that meditation and the acknowledgement and giving it the space and time it deserves. I think I spent quite a few years either over addressing and spending too much time in that space or pretending like everything was fine and actually finding I'm getting worse and sleeping worse and more concerned about this, even though I'm trying to put it to the side. So, acceptance, thinking, giving myself the time to acknowledge maybe today's worse than it was a few days ago, and then not feeling guilty about that moment and just living in it. And then I go straight to all of the things that I'm here for. I am here for my children. I'm here for my family. I love my job. I feel very lucky. So, those things that give me peace immediately bring me to a place of happier being. And I'm reminded of why I continue to show up every day. And those things just sort of soften some of the alarm bells that go off when you're having a worse day than others. Those are my key things that if I don't acknowledge, I don't give myself grace when I'm having a bad day, and I don't remind myself of what I'm here for and the amazing people and support things I have around me, I don't know that I would be able to keep going each day. So those are my keys.
Yeah, you come about it so strong that it's even difficult for somebody who doesn't know you to even believe that you are in a lot of pain. Explain a little bit what you do professionally, because you explained that you are a mother and you're a daughter, you're a, a wife, and but on the professional side, because it's important for people to know that you do all of that, you're suffering from pain, but you're also a very active professional.
Yeah, I'm an insurance professional. I lead a large department at a Canadian insurance firm, and I'm responsible for quite a few different teams around quality assurance and learning and development and communications and licensing. And I absolutely love what I do, and I love the people I work with. And I'm very passionate about making sure people have the right knowledge at the right time for the right role. And I joke often when I'm talking to my teams around making sure that we build onboarding programs and education programs that are fit for purpose, but we equally need to do the same for ourselves. So I felt I can't be someone who preaches go get the education that you need and understand the requirements for success if I don't apply the same
Right.
in my personal life too. So that's where I would like all knowledge to be more effective, and that's how we can spread it by making sure people have access.
To use your experience as an example, and that's a way, probably a partial way of your guidance and management. You talk to them about your personal experience and try to motivate them and how they can overcome difficulties from time to time.
Absolutely.
Yeah. Um, there are times in life that bad things happen and we are pushed through a journey that leads into mm, further growth, and we learn things that otherwise we wouldn't bother to go and acquire that knowledge. Do you think that your pain has brought you to a journey of healing, that you learned a lot of new skills?
1000%. And I tell people all the time that a comfort zone is a beautiful place, but nothing ever grows there.
Yeah.
And it isn't until you're faced with adversity or a challenge or a critical decision to make that that's when your growth happens. And absolutely, that's what's helped me become who I am. It's not pain is not me, but it is a part of what helps me be who I am.
Fantastic. I'm going to ask you to say a few last words to all the thousands of patients that are out there, whatever message you want to give
Oh
them.
my gosh. Well, I just want anyone listening right now who maybe isn't at this wonderful phase of the journey that I've arrived at, maybe you're still in the deep valley of despair. There is so much hope, and it does not matter how long you have felt unwell for. That's the part I think is so important. It doesn't need to be, a result of an injury yesterday. If you have been suffering for a long time, there are people like you out there that have still managed to overcome and have found happiness again and have found genuine strength that they can pull from. So I would just want everybody to not give up and keep trying. I mean, just because one method doesn't work for you,
Right.
pivot and keep going. There's probably something that will work.
Fantastic. I hope that your message will reach thousands and thousands of patients and they find hope and hopefully healing.
Thank you so
Thank
much.
you so much for your time and thank you for coming today.
Thank you.